Hello, everyone, and welcome. We will wait just a few more moments for everybody to get settled here, and then we will get started. All right, well, everybody is still finishing joining us here. I would just like to say hello to everyone and welcome to the February 2023 PQA Quality Forum Webinar. My name is Amanda Ryan. I'm the Director of Education here at PQA. And today's topic is the 2022 PQS Trend Report in Pharmacy Quality. But before we get started with that, I would like to walk you through a few housekeeping items. First, as usual, please submit your questions to us using the Q&A feature that you will find located at the bottom of your screen. I do encourage you to do that throughout the presentation. That allows us to collate and organize your questions so that at the end of the presentation today, when we do our Q&A session, we have everything all set up for you, and we will get to as many questions as we can during that portion. Also, the webinar recording and slide deck will be made available to PQA members within the week following the webinar today. And those recordings and slide decks will be on the member resources section of the PQA website. And then additionally, we will also publicly post the recording to PQA's YouTube channel. And then finally, I'd like to encourage you, as usual, to please complete the quick 1-minute survey that will pop up at the end of the webinar. We do use your feedback to help us form future webinars. PQA would like to thank Pharmacy Quality Solutions for being an educational sponsor for today's Quality Forum. Thanks to PQS for your support of PQA, not only today, but throughout the year as well. You can learn more about PQS at pharmacyquality.com. And with that, it's now my pleasure to introduce you to today's speaker. Andrew Thorne is the Senior Manager of Data Analytics at Pharmacy Quality Solutions. He serves as the content matter expert for performance measures and also leads scholarship initiatives at PQS, in addition to heading the analytics team. He is a pharmacist with residency training in clinical pharmacy practice and health system pharmacy administration. Prior to joining PQS in 2021, he was a system clinical manager of investigational drug services at UNC Health in Chapel Hill, North Carolina. Thanks so much for joining us today, Andy. And with that, I will turn the floor over to you.
Thank you, Amanda. I appreciate the brief introduction as well. Amanda mentioned that I lead scholarship efforts at PQS, and primary among those is that I lead the team that produces this PQS Trend Report in Pharmacy Quality. And on the screen now is our roadmap for the presentation today. First, I'm going to give a bit of background on the Trend Report, why we started the initiative, and what we focused on in the past before then going through the 3 chapters of the Trend Report and summarizing at the end. We first started producing the Trend Report at PQS in 2019 for multiple reasons. We can all have our own language from different perspectives as in our industry. And in part, the Trend Report is an effort to create a more common and consistent language when we talk about trends in pharmacy or medication use quality, and make sure that this incorporates perspectives from all stakeholders, all the way from the patient through pharmacies and payers as well. Additionally, we hope that the results from the report will support our customers in crafting their strategy, and we try to craft the focus of the report to make sure that we're keeping our thumb on what's happening in the industry. We published the first report in 2019, and the 2019, 2020, and 2022 reports all follow a similar structure like this one that we'll talk about today, of a 3-part survey. The 2021 report was a bit different in structure. It focused instead on a set of analytics related to changes in medication utilization that were caused by the COVID-19 pandemic. The 2023 Trend Report will again be a special topic focus with analytics. And then we'll return in 2024 for the 2024 report to this similar survey structure. Now, to dive into the content, for the first chapter, it was a survey of consumers. Putting things into 3 buckets here for the questions that we had as part of this survey is a bit of an oversimplification, but the survey of consumers can be thought of to have focused in these 3 areas: consumer perceptions of pharmacy, their utilization of pharmacy generally, and then questions about specific services in the pharmacy setting. And what we hope to gain from this and all of these questions is a good perspective on how consumers are engaging with pharmacies and where there are opportunities for us to improve that relationship and to further the utilization of services offered. As a side note, I'm going to be presenting data not from all of our questions in any of the 3 survey sections. What I have time to share today is what I felt were the most interesting or the most impactful results for discussion. But there's a lot more in the official trend report, and you can access that at our website, pharmacyquality.com. First up, some details about the panel. We worked with an existing panel through a market research group that is utilized for various kinds of other consumer market survey work as well. We only accepted fully completed surveys and only surveyed consumers who are utilizing pharmacy services in some capacity, even if that utilization was relatively infrequent. The survey was conducted in March of 2022, coming up on a year ago, with first done some small tranches, and then it was deployed more broadly once those tranches proved that we knew the survey was working as intended. In total, we received 800 completed responses across the country and from a diverse demographic, which I'll give some details on in the next slide. There were some responses removed from the data set if those responses gave a strong evidence of lack of data integrity from the responses of that individual, but thankfully that was only a small subset of the completed responses that we received. In terms of demographics, we'll go through that here. And I should note, for most of the visuals that we're going to be looking at, and I'll share through the presentation, we'll show the data from all 3 years of the survey format of the trend report in 2019, 2020, and 2022 to be able to show those trends over time. For this survey in 22, we were happy to see that the gender demographics ended up more balanced than they had been in the past, making our sample more representative of the population with roughly a 50-50 split. For respondent age as well, we saw a reduction of the youngest categories and a shift toward an older or a bit older demographic when compared to 2020. For 2022, the largest single age range was respondents aged 35 to 44. And for both the 2019 and 2020 report, the largest age group was those aged 25 to 34. All right, so now we'll get into some of the questions from the survey. This question was one of a set of questions that were designed to assess the respondents' perceptions of the profession of pharmacy, and specifically here, whether they were comfortable with a pharmacist working with their provider to make clinical interventions when clinically appropriate. On the whole, the consumers we surveyed were comfortable with this aspect of the pharmacy profession, though we did see some drop in those who expressed comfort with this when we compare it directly to 2020. This is a question we plan to keep in the survey for future years, so we'll be able to assess it for further trends going forward. And also, as a note, we try to change less than 10% of the survey each time we've done it, so that we can maintain that integrity for the ability to trend these questions going forward. The next question was around vaccination, and it's one of those designed to assess current utilization of pharmacy services, specifically vaccination. We found that nearly 2/3 of respondents told us they had received a vaccination in a pharmacy, with the vast majority of those patients saying they'd received one within the past 12 months. When we went into this survey for 22, we all anticipated that we would see more movement in this question when comparing to earlier surveys, given the importance through 2021 and 2022 of community pharmacies in the efforts to administer COVID vaccinations. The difference that we did see was less than we had anticipated, though I think here that we are beginning to see the start of a trend toward increased immunization uptake in the pharmacy setting. In a related question, we asked consumers how comfortable they are receiving injections, including vaccinations, from a pharmacist. And overall here, we see a lot of expressed comfort with this, though not much movement over time in that level of comfort. Keeping in mind, though, from the last question, that 63% of patients told us they had received a vaccination in a pharmacy at some point, we see that 70% of respondents here in 2022 told us that they're comfortable or very comfortable with receiving an injection from a pharmacist. When we noted that difference between those who had received a vaccine and those who said that they would be comfortable receiving injections in a pharmacy, we wanted to do some analysis to stratify respondents who told us that they would be comfortable by whether they had received a vaccination, to see what those different groups had said for the two questions. Somewhat surprisingly, we found that even among respondents who had never received a vaccination, their expressed comfort with receiving injections from a pharmacist exceeded 50%. More than half of them, having never had received a vaccine in a pharmacy, still said that they would be comfortable receiving injections from a pharmacist. This means both that some patients who are uncomfortable with injections are getting vaccines in a pharmacy anyway, but more importantly, I think it means that there's a reasonably large pool of people who are comfortable getting vaccinations in a pharmacy, but who are not utilizing this service currently, representing a gap of patients that we could address to utilize more services of vaccination in a pharmacy setting. Similar to injections, we asked respondents how likely they would be and how comfortable they were with a pharmacist performing various tests should the patient need them. In every case, the majority said that they would be likely to have these tests done by a pharmacist, though there was variation across these tests and a bit of a downward shift when compared to the same questions in 2020. Across the board, likelihood was greater than 50%, and the most likely tests were blood pressure, followed by flu testing, and then cholesterol. New to the survey in 2022, we asked some questions about the effect of COVID-19 pandemic and on the perceptions of respondents. As I said earlier, when we went into this survey, we anticipated that some of the changes we all know happened in the pharmacy setting related to COVID-19 might have shifted some of our earlier responses, but that was also the impetus in adding these questions to assess what kind of impact the pandemic had had on patient perception. First, we asked about changes in comfort level with receiving healthcare in a pharmacy setting, and just over half of the consumer panel told us that their feelings were unchanged compared to prior to the pandemic. Of those whose comfort level did change, 26% said they were now more comfortable, and 22% less comfortable with receiving healthcare in a pharmacy, so not a large change overall. We believe that we're seeing two trends in this question with opposing effects. On the one hand, a lot more patients came to pharmacies after COVID hit to either get tested or to receive vaccinations, giving more and more people a personal experience with utilizing pharmacies in this way, and leading to increased comfort for many of those patients who had a good experience. On the other hand, COVID necessitated that really everyone became much more aware and painfully aware of how communicable disease spreads. And we've seen other studies detailing that COVID caused many people to be more cautious about public spaces and particularly about healthcare spaces. Related, similar question, we asked how trust in healthcare providers had been impacted by COVID-19. Similarly, the majority of patients told us that there was no change, and some had an increase and others had a decrease in their trust level. In this case, however, nearly twice as many of those who experienced a change had an increase in their trust level of healthcare providers. I should note that this is not specific to pharmacy. You'll note we did specify and give some examples of doctors, nurses, pharmacists, etc. But we asked those who had a change in their level of trust if they would provide a response as to why their trust had changed. And we received a lot, over 200 responses from those whose trust level had changed, and many of those focused on pharmacy. I want to share a couple of those responses to exemplify a couple of themes, major themes that we saw in those responses generally. This individual responded, "Yes, my trust has increased. I was previously ill-informed. Now I'm better informed on the qualifications of a pharmacist and trust them more with a variety of situations." This was similar to many responses that indicated some kind of lack of knowledge about the qualifications or the ability or the capabilities of a pharmacist to perform certain tasks or to do certain things. Closing that knowledge gap for many respondents through increased exposure to pharmacies through COVID-19 presumably led to an increase in that trust. The second example told us pharmacies particularly have become useful and convenient places for excellent and quick care options. I've gotten COVID-19 testing and vaccines at local pharmacies that have been fast and services at reasonable prices. This is indicative of another theme related to pharmacy meeting the needs of patients with good service. This example mentions COVID testing and vaccines, reasonable pricing for services, and the ease of obtaining those things quickly in a pharmacy setting that is close to them. All three of those themes were mentioned by many other patients, and this one happened to mention all three in one comment. For the first chapter, we surveyed a large panel of consumers on their perceptions and utilization of pharmacy services, and I think we found some interesting results. Most were not dramatically changed from the previous surveys in 2019 and 2020, though we did see the beginnings of some trends that we're going to explore further when we repeat these surveys in 2024. One of the most interesting results to me, though, was that a majority of patients told us they're comfortable with a large variety of advanced services in a pharmacy setting, even if they had not taken advantage of those services themselves yet. This aligns with the finding that consumers expressed a great deal of trust in pharmacy and pharmacists in particular. My biggest take-home message from this section of our report is that there's a gap between the level of utilization of services and the level of comfort that patients tell us they have to utilize those services. The willingness and trust is largely there to increase that utilization, which I'm sure many of us will be or already are working to facilitate through various programs and outreach to those patients. From there, we'll move on to the second survey portion, which was from pharmacy organizations. For this survey, we focused on reimbursement and preferences for reimbursement from these pharmacy organizations, on capabilities that the pharmacies have to track labs and other data in their systems, as well as their capabilities to support outcomes-based initiatives and other testing in the pharmacy. This was both from a staff training perspective, as well as a willingness and readiness perspective, and we've got specific questions for all of those areas, those sub-areas. The distribution of pharmacy groups that responded to the 22 survey was a bit different in some ways to prior years, with the addition of two categories we'd not had previously, mail order and specialty pharmacies, and with an increase in proportion of independent pharmacy respondents, with then independent pharmacy respondents being the largest group for 22, followed by grocery store with pharmacy, and then retail chain and mass merchant. The first couple of questions are going to focus on reimbursement and contracting. For this question, we asked respondents, if your pharmacy were to be held accountable on the basis of quality measures, which option would you feel most confident linking to reimbursement? And the highest proportion of respondents here indicated confidence in a mix of intermediate outcome and outcome-related measures performance being tied to their reimbursement, which has trended strongly upward over the course of our 3 survey periods. Overall, we're also seeing a clear shift away from the left end of the spectrum here, of fee for services only, toward more confidence over time in tying reimbursement on the pharmacy to outcomes-related measures or intermediate outcomes. In a related question, we asked pharmacy representatives what their likelihood would be to contract with payers if the payer were to offer a program of reimbursement tied to either intermediate outcome quality measures or to outcomes-related quality measures. And overall, you'll see in the distribution here, we see a high likelihood of contracting for both types of programs, though more felt very likely to contract for intermediate outcomes measures-based programs than for fully outcome-related measures programs. And when considering the results from the previous question, where an increasing number of pharmacy groups expressed confidence in reimbursement based on programs utilizing these measures, it shouldn't really be a surprise that so many say they're likely to contract for such programs if those programs are offered. Keep in mind, however, that there were still, from the previous question, roughly 25% of pharmacy groups who said that they were still most confident in fee-for-services only as their reimbursement model. And these folks largely still said for this question that they are at least somewhat likely to contract for a program based on intermediate outcome-related quality measures or outcome-related quality measures. So while it may not be the primary preference of all pharmacy groups, those pharmacies through the survey here are telling us that they're displaying a willingness to engage in programs based on outcomes. We also asked these groups to tell us how prepared they feel they are to engage in programs, were those programs to be offered today. Response options range from being ready today with no additional training necessary, though through to no capability today and no expectation that they would have ability within the next 24 months. And you can see the stratification of responses across the years and in the two different areas. 91% in 2022 said they currently have the ability to support intermediate outcome measures, and even a majority told us that they are ready today to support outcomes-related quality measures. We did see a dip in the perceived readiness in 2020, but those levels bounced back and exceeded the 2019 numbers in the 2022 survey. I should also note, perhaps should have said earlier, the 2020 survey was completed prior to any national lockdowns or the declaration of a state of emergency for the COVID-19 pandemic, but not long. It was the end of February, early March, when the 2020 survey was completed. To dig deeper and understand some of the responses there around reimbursement and capability for any contracting, we asked these groups specifically about the capability of their software systems and any training needs for their staff for outcomes-related performance measures. And first, these are the results when asking about capability of current dispensing software systems to record and track lab values, etc. A quarter were unsure. Another quarter felt the software was not currently capable, leaving roughly half of respondents who felt the software is at least somewhat capable, though a third felt it would need enhancements to be ideally set up for the purpose of intermediate outcome or outcomes-related quality measures data tracking. This reveals that there are gaps in software capabilities that may need to be overcome for the successes of this type of program. And this can be a real hurdle, as software changes and updates are not easy, can be costly, and they can be really time-consuming. It may not also be, most groups, many groups at least, are using software that has been developed not in-house. So they may need to work with an external party to update software capabilities, which adds additional time and effort to the process. We also asked the pharmacy groups about the need for any additional training of staff so that they understand and are ready to support outcomes-based quality measures. In this regard, respondents felt a little bit more confident in their staff readiness than in their software, with around 60% responding that they would either need no training or only very little training for such programs. The final things I'll go through for this survey is that we asked about specific tests and the pharmacy's capability to perform those tests in the pharmacy. I'm only going to show and discuss a couple in this presentation, but there are many more in the full report. First I'll show is blood pressure. And blood pressure was the test that the most respondents said they were ready to do in the pharmacy today. Unsurprising, it's relatively non-invasive, with 45% of them saying that pharmacists are actively even recommending blood pressure testing to their patients. The other that I'll show here is A1C or hemoglobin A1C testing. There were more respondents who indicated that they don't have current capability with no plans to change that, but we still saw that the majority, 64%, indicated they have capability, and 41% are actively recommending this testing to their patients. To wrap up this chapter, pharmacy groups told us through the survey they're increasingly confident to link reimbursement to performance in the form of intermediate outcome or outcomes related to quality measure performance. They also indicated by and large that they're ready in current state to take on such programs, but that staff might need some light training. Where they identified a larger gap in current capability was in their dispensing software and that they're currently using, and its lack of ability to track data for some outcomes related measures data. We also found that most pharmacies have capability to perform testing in the pharmacy that would gather what we feel is meaningful data in relation to quality measures, most notably blood pressure and A1C, but those are not the only. There's other testing that pharmacies told us they're ready and prepared to do in the pharmacy setting. Ultimately, in my mind, all of this adds up to a strong message that pharmacies are ready to take steps toward improving performance and meaningfully participating in programs that are based on outcomes-related quality measures, patient outcomes, and the performance on those measures. All right, finally, we'll move on to the final section of the survey for the report. And for this survey of payers, we focused heavily on assessing the challenges related to successes that payers are seeing with their efforts toward performance improvement. A lot of the questions in this section presented payers with many options and asked them to identify all that applied. So we're going to see a lot of percentages that don't sum up to 100%, well over 100%. This was in an attempt to recognize that there are really a mountain of challenges and that those challenges overlap in a lot of complex ways. Additionally, we wanted to get the perspective of payers in terms of partnerships with community pharmacies after we'd assessed similar readiness for programs from the pharmacy side in the previous section of the survey. In terms of the payers who responded to the survey and their distribution across types, most categories did not shift for this composition, though we did see an increase in respondents representing a PBM or PBA. The majority of the respondents, though, still represented health plans like in previous years. Of note for this question as well, respondents could choose all that applied to their organization. Up front in the survey, to get a sense of context for the rest of it, we wanted to get a sense of the reimbursement structures that are being utilized by these groups. A little bit of the flip side in terms of talking about reimbursement in the pharmacy survey. Here, to make sure that we're aligned on definitions, talking about upside benefit, that's when providers are eligible to earn all or a percentage of any healthcare savings that their care incurs. And in these cases, there's no risk or penalty for not meeting performance thresholds, but the providers would just miss out on the bonus amount. Two-sided risk is a combination of upside benefit and downside risk. And for downside risk, providers who incur actual care costs that go over the financial benchmark must refund the payer for all or a portion of the difference. This is a withheld amount where provider performance determines the percentage of withheld dollars that could be earned back. And of course, among all of these, there are various flavors and details and specific approaches that are used in different programs. We see that about half of respondents are using upside benefit and two-sided risk with a little bit less utilization of downside risk. For the next set of questions in the survey, I've done my best here to represent a large data set with many possible responses for each question. Like I said, we went through many options to represent the pile of challenges that are proposed or that are faced here. And the visualizations of the year-over-year changes for these challenges is quite busy. In the report, if you look at the full one, essentially each question takes up an entire page of the report. So I haven't pulled those directly into the presentation here, but you can, of course, view them in the full report available at our website, pharmacyquality.com. The first question we'll discuss is assessing what challenges to improvement respondents have been experiencing. And this is, as I said, not a full list, but this represents those challenges that were identified by the most payers. Topping this list is understanding which interventions have the greatest impact, aligning quality improvement within their organization, and attempting to cover all challenges and efforts with admittedly limited resources. Understanding what has greatest impact has been consistently near the top of the challenges list through the years of the survey, though alignment within organizations is newly near the top of this list, kind of rising in the list as an up-and-coming challenge. How to focus limited resources was a new option in the survey in 2020, but then again in 2022. And in 2020, it was also high on the list of identified challenges. In this list, we saw some movement for aligning with external providers, which is a little bit down in the list compared to previously. That was at 79% in 2019. And also we saw some improvement that happened compared to prior years with the challenge of provider awareness, which is now down to 52% from a high of 79% in 2019. Using the same list of possible challenges, we asked respondents to identify the challenges where they've seen the most successes in recent years, after asking them to identify those that have been the most challenging. Interestingly, the same 3 challenges top this list as the prior list. So the same 3 challenges have been identified as those by payers where they found the most success, as were identified by the most payers as the biggest challenges. And that's encouraging to me, meaning that they've been significant challenges, but focusing on these challenges in particular has brought a lot of success in overcoming them. We also asked, what challenges have you been unable to overcome? And again, this was the same possible list of long list of challenges. Topping this list are challenges with high cost, high utilizer members impacted by social determinants of health, lack of timely data from external sources, and finding alignment for quality improvement across external providers. These are all very challenging things. And this will really not likely be the first time you've heard social determinants of health discussed recently as a difficult challenge to overcome quality improvement. I know there's current focus on this issue from PQA as well as from many other groups. Personally, this is very challenging in the setting of quality improvement, in part because a lot of what we do is set up to benefit populations generally or focus on populations generally. But the social factors that can challenge individual members can be many, they can be overlapping, complex, and exceptionally individual. From the past work I've done in clinical pharmacy, I've seen firsthand how much extra support patients that fit into what we would categorize here in this category, they deserve and need a lot of extra support to experience improved outcomes. So not surprising that is a challenge near the top of the list. We moved on then in the survey to talk about partnerships with pharmacies, contracting with pharmacies. And similar to our questions to pharmacy organizations about readiness for contracting, we found that overall likeliness was high. Specifically here, we assessed this for a hypothetical program where pharmacies would submit biometric testing data for a quality measure that would meet the quality criteria for inclusion into those measures. And we see a consistent trend over time here with more payers expressing high likeliness of contracting with pharmacies for this type of program if the data can meet the quality criteria. One caveat here is that in 2022, 29% of payer respondents were unsure of what their approach would be, though it's encouraging that 2/3 expressed likelihood of contracting with pharmacies for this type of program. We also asked payer respondents to get a sense of what measures specifically the payer community feels are impactable by efforts in the community or in the community pharmacy space. And impressively, the vast majority of payer respondents had high confidence in the ability of pharmacies to move the needle for a long list of measures. This is not the entire list. As with others, there's more that wouldn't fit on a slide like this. No surprise that the top 5 of these measures is 4 out of those 5 are Part D measures, but the top of the list was actually vaccination. Several other Part C measures are also on this list, and there were a total of 11 different measures that at least 2/3 of payer respondents identified they felt pharmacies can influence outcomes for. These are very high percentages of response from payers. If you recall, that most pharmacy respondents said they have capability to perform blood pressure and A1C testing. I think it's notable that controlling blood pressure and 2 diabetes care measures related to A1C testing are on this list as well. To summarize for Chapter 3, payers are utilizing a mixture of incentives in their contracts, and there are some significant challenges that remain to performance improvement, despite some meaningful progress and successes with several of those challenges, even some of the most challenging. Payers are telling us that they're likely to contract with pharmacies for biometric testing if the data and documentation are of sufficient quality to be of benefit to the payer for the quality measures that they are tied to. And pharmacies are recognized by payers for their ability to influence and impact quite a long list of quality measures. Ultimately, I feel this all adds up to a meaningful opportunity for payers and for pharmacies to work together on quality improvement and to further bolster the programs that are already in place to do so. We've heard this message from both pharmacy groups and from payers. To wrap us up with just some final summaries, trying to summarize a 40-plus page report into 3 final thoughts here. Consumers are telling us that they trust pharmacies and are willing to increase their utilization of services in the pharmacy beyond current levels. There may be from consumers some misunderstandings and a lack of knowledge that these services exist in a pharmacy, though COVID has partially closed that gap due to the efforts of pharmacies in testing and vaccination. We still, I think, have some room to go. Pharmacies are capable of testing, and they are ready to take on value-based arrangements that are tied to intermediate outcome-related and outcome-related quality measures. And likewise, payers recognize that pharmacies are capable and feel that they have a meaningful part to play in improving medication use quality. There's a willingness on both sides to engage further with contracts with pharmacies for this type of work. Quality improvement is continuous, and we have room to go. We're doing better than in past years, as evidenced by a lot of year-over-year increases in quality performance scores in the last decade. But we recognize that we have more improvement to make and more improvement that we can make. Overall, the results from our survey indicate that all parties involved, from the consumer to the pharmacy to the payer, are ready in the right ways to work together to continue to close those gaps and to move toward improved medication use quality together. I want to thank PQA for the chance to share the results today and talk to you about our trend report. Also, thank you to the teams at PQS and PQA who supported the project and whose work was instrumental in putting together the 2022 Trend Report on Pharmacy Quality. And again, finally, I'll plug the full report, which you can access at pharmacyquality.com. It has a lot more detail and discussion around all the items I've presented, plus more questions that I just didn't have time to get to here today. So thank you again. Amanda, I'll pass it back to you.
All right, thank you so much, Andy, for sharing the trend report with us today. I'd like to remind the audience that you can ask Andy some questions using the Q&A feature that you will find at the bottom of your screen. We do have a few questions now, but if you've got some more, go ahead and send them along as we have some time here for some discussion. The first question, Andy, is related to the demographics of the consumers who responded to the survey. So you mentioned some demographics related to gender and age, and so we would like to know if there was any other demographics that you captured. So we're thinking a lot about health equity, diversity, equity, and inclusion and related topics recently. So anything related to those particular characteristics that you gathered on the consumer respondents?
Yeah, that's a great question. There are some more details in the trend report around the consumer panel. We did ask some additional questions to assess many of the things that the questioner just listed around race, region, etc., and even whether those individuals had health coverage and what type of health coverage they had. There were a few of those questions that, due to an issue with the survey, we didn't feel gave good validity, so we didn't include them in the final report. We'll try to fix those things for future years to make sure that we can potentially stratify by type of insurance. In particular was one that I was disappointed we couldn't include. So it's a good question, and there are some more details in the report, but not as many as we hope to include in future reports.
All right, thanks for that additional information, Andy. We do have a question, and we might want to go back a couple of slides if you would like to, but about the percentage of payers who responded to the survey who are PBMs and health plans. So if you've got that off the top of your head, great. Otherwise, if you want to go back, we can do that. I
think I've got it off the top of my head reasonably. I won't make everyone dizzy going back that far. It was good. Around 52 or 53% were representing health plans, and somewhere around 40% of PBM or PBA. But keep in mind, for that question, it was a multiple response available option. So there would be, that one doesn't sum to a lot more than 100%. So there weren't a lot of respondents who ticked more than one box, but there were some.
Okay, perfect. Thanks so much. Next question is, given all that happened during the pandemic related to COVID-19, why do you think consumer confidence or comfort in pharmacy isn't higher? So perhaps a little bit of speculation here, but what are your thoughts on that?
Yeah, honestly, this is one of the things that I gave more thought to once we finally saw the results than just about anything else, because we did expect that there would be a lot more movement in the level of comfort, as I'm sure the person who put in that question would have assumed as well. If you're working in a pharmacy, you know exactly how many people have come through for COVID testing, COVID vaccination services. So we were somewhat surprised by the data. We think that there may be two things at play here. At the front, I talked a little bit about demographic shifts that we saw in the consumer panel. We did see some shifting in age, and we saw some shifting in gender as well. And we dive into that a little bit in the report, that some things that you might expect to be different about a different age group and different about a different gender demographic could be moving those numbers slightly. But we also think that, as I mentioned earlier, there are competing headwinds when we think about what COVID did for how people feel about pharmacies, physician clinics, concerts, any public area, where there's some level of increased wariness to just being in public. And I will say, for myself, I worked for much of the pandemic in a healthcare setting, wearing a mask every day at work, and that is not my favorite thing. I didn't mind being able to take off that mask when now I'm working mostly from home. So there may be some of those little things at play as well. It's hard to tease out. So you can tell we had a lot of discussion around this, and it wasn't quite what we expected either.
Yeah, absolutely. And as you mentioned, lots of factors at play and lots to tease out. So thank you for being willing to share your speculations and ideas with us there.
To speculate, yes.
There you go. This one's a little bit similar, but what do you think it would take to see greater collaboration between pharmacies and payers to improve quality measures? So making progress in that area, but how can we do even better?
So I'll speak only from my perspective. I have worked in health systems, and then now with Pharmacy Quality Solutions as a neutral third party. I've not ever been in the deep workings of a large pharmacy organization or at a health plan or PBM. But from the perspective that I have at PQS, I think that a lot of what can be done is aligning in the good things that we all want to do. Whenever I meet with folks from a pharmacy organization or with folks from a health plan or PBM, we all want to improve quality for patients. We, as different organizations, have different external incentives that are at play. But I think that there have been a lot of good examples in the market of aligning those incentives with the common desire that we all have to improve quality for patients, and then to build those programs around making that work for both parties. And PQS, we've put a lot of effort into that. We feel that we're filling that role in a certain way as the neutral third party between those two kinds of organizations. But the proof is in the pudding, I think, that we're doing something right in that year over year. When you look at Part C measures that can be impacted by pharmacies, and particularly Part D measures, we see consistent increase in performance and have for a long time.
All right, very good. Thanks, Andy. One question about gathering additional data about staffing. Was that included pharmacy staffing data or questions as part of the survey or the report? Anything in there that you could comment on?
Not to a level not to a specific level that the questioner is thinking at the frontline level. We did ask the pharmacy organizations to identify their relative size, how many pharmacies, but it was not included into the survey around specific staffing challenges. We know that that's a challenge, but we didn't want to change the survey too terribly from previous years, and we wanted to include the COVID related questions. Though, thank you to the person who submitted that question. That bolsters the argument to include that type of question in the 2024 report.
All right, thank you. Got a question on some details from slide 40 here about where you outline that community pharmacies could influence quality measures. So this questioner is wondering whether those were STAR measures, HEDIS measures, or something else.
I'll go to this slide because it's not too terribly far, so we don't have to go through 20 to get there. I believe this is the list that they're thinking through, and these are in large part STARS measures, yes. So 4 out of the top 5 here are Part D measures, the 3 medication adherence measures, and then MTM completion rate for CMR. But then additionally, things like controlling blood pressure, statin therapy for patients with cardiovascular disease, and the diabetes are HEDIS measures that are a part of Part C. So these are measures that are being identified by payers, that they feel pharmacies can make a difference in these things as long as the parameters are correct. We're undergoing at PQS some initial programs to try to get into this space and to foster this relationship between pharmacies and payers, and have found some good traction and success there. And that's another thing that, in line with my previous answer to another question, that gets us all on the same page and finding good incentives to get at the deeper motivation of the reasons that we're here doing the things we're doing.
Absolutely. Thanks, Andy. You know, while we're on this slide, let's ask a related question. So when we're thinking about, measures that pharmacies can influence, there's a lot of data collection that needs to happen and data sharing. So if there's a pharmacy that's documenting, say, blood pressure or A1C data, can they send that data to a health plan for incorporation into HEDIS measure results?
They can, yes. The requirements for doing so are sometimes subtly different measure by measure, but for the large part, if a biometric test is done in an FDA compliant way and documentation meets some reasonably simple marks of quality, that it is similar to an electronic health record, which, when I say electronic health record, many may think my pharmacy system is not an electronic medical record or health record, but there are really only a few hallmarks that type of thing needs to meet to be persistent documentation to meet those requirements. So yes, they can meet those quality requirements to then flow through into HEDIS measures. It's not every type of documentation. If you just write down into a note that doesn't have any structure or data structure to it on your patient profile, that they told you that they took their blood pressure at home themselves, then that would not be of sufficient quality to move into the measure. But if the blood pressure is done in the pharmacy and documented similar to a health record, then we've seen examples in pharmacies where that can flow through to HEDIS measures.
Okay, very good. Thank you. We actually just got another question related to this topic here. Was statin use in persons with diabetes included in these measures? In
the measure list of questions around payers,
yes,
this one that we're displaying. Yep. I believe that it was. And again, I am only displaying down to those that received 2/3 or more of payers that responded that they felt pharmacies could influence these. There are many more measures that we give the respondent percent. I won't make everyone wait for me to pull up the full report, but I believe that was in there on that list as well.
Okay, very good. We have another question about clarifying some of the information back on slide 35. So you mentioned the different types of reimbursement structures for providers that they're in with payers. And is the focus on the slide, are you talking pharmacies, health systems, or both?
For this question, this is a good question. For this one, we did not specify. We asked the health plans of the providers with which you have value-based or outcomes-based contract, what reimbursement structures are used. Now, the context of the full survey was primarily with pharmacy, but that's a good call out. We did not specify providers, meaning pharmacies in this case.
All right, very good. Another question for you. This is back to the demographics of the consumer panel. So as you mentioned, the age range was mostly on the younger side, at least mostly younger than 65 for sure. So do you feel like this makes your results less reliable for the Medicare population?
Another great question. We don't have good data to answer that specifically, because we don't have for these questions, we don't have another data set to compare to. Personally, I would love to see in future surveys that we continue to shift that age range to be a little bit more representative of the Medicare population. We did see a shift towards an older age demographic in 2022 compared to prior. And also keep in mind, these are not any consumer. Only those whose results we're showing here were completed surveys of people who utilize pharmacies. So I am not of Medicare population, though I do utilize a pharmacy. So for me, I would have some skin in the game and some experience, but would not be representative of that specific demographic.
And these surveys were conducted electronically, correct? Do you think that could have an influence at all?
Yeah, from a speculative perspective, yes.
Yeah.
Yes, I think it
Okay.
could.
All right, fantastic. So thinking about the future a little bit, I think you mentioned a bit about the 2023 trend report, but could you tell us a little bit more about what that might look like next year?
Yeah, happy to. So we are, the trend report is a year-round thing that we're thinking about and working on. We are already into doing some of the work for the 2023 trend report. It will focus on factors that affect performance in quality measures. So we're going to be looking at factors that affect performance from the pharmacy side, factors that affect performance from payer and program design side, as well as things that are external to both of those groups, be they natural disasters or other incentives in the marketplace, et cetera. So we're putting out, I was going to say we're putting out feelers, which makes it sound like we're soliciting suggestions, which we kind of always are. You can email us if you have thoughts about the trend report, but we're exploring many different avenues of looking at what out there in the market affects performance.
All right, very good, Andy. I think we will leave it there. Once again, we appreciate you sharing all of this fantastic information with us and look forward to seeing what's happening with next year's trend report.
Excellent. Thank you again.
Sure. All right, I'm going to move us back to the end of the slide deck here. Give me just one moment. All right, and we are going to close out today with some announcements and some ways that you can become engaged with us here at PQA in the coming weeks and months. So if you look in the chat, you will see a series of links that I just posted. So we're going to refer to each one of these in turn now over the next couple of minutes. So first of all, we invite all of you to please join us May 10th through 12th for the PQA annual meeting. The 2023 annual meeting will be in Nashville, Tennessee. It is a 3-day meeting that features speakers and educational sessions that address both top issues and emerging trends in medication use quality. We also focus on measure development and implementation, as well as care transformation. We do have an early bird registration deadline that is April 14th. The registration link, as I said, is in chat right now, or if you would like to scan the QR code on your slide, that will take you directly to the registration page. In addition to that, we invite you to join us for a pre-conference workshop that will be on May 10th. It is called Medication Use Quality, a PQA Live CE event. It's credited for 4 hours of pharmacist CE, And it will allow participants to engage with faculty. We'll do a series of question and answer sessions. We have a lot of dynamic group discussion in that, and we also have a lot of activities. You can use the registration link once again in chat, or we've got the QR code on the screen. Either way, that will get you to the registration page for MUQ Live. Next, if you are a student, or if you know a student who would like to become more engaged with PQA, I've got two opportunities to share with you now. The first is the 2023 PQA Healthcare Quality IQ. This program teaches students the basics of quality measurement and also strategies to improve medication safety, adherence, and appropriate use. Students will receive a scholarship to attend the 2023 PQA annual meeting. They will also get to participate in the medication use quality certificate program that we have here at PQA. And there is also an opportunity to develop their own quality improvement proposal. Nominations for this program close on February 24th. So please see the link in chat for more information and to apply. And I'd also like to mention that this program is sponsored by Pharmacy Quality Solutions, and we would like to thank PQS for their support. Next, we have a second student opportunity, which we just announced this week, and that is the Diversity in Quality Scholarship. Students who have completed their second year of study, either in a pharmacy program or in our other healthcare degree program of some kind, and are part of a minority group that is underrepresented in quality, is eligible to apply for this program. Individuals who are selected for a scholarship will receive complimentary registration to the PQA annual meeting. They will also be able to attend the MUQ Live workshop. They'll receive 3 nights hotel stay and a travel stipend. Self-nominations for this scholarship are accepted through March 17th, not May, March 17th. And you can use the link in chat for more information on this. And then finally, please join us next month for our webinar, which will be a Quality Essentials webinar. It will be on Thursday, March 16th from 1 to 2 p.m. Eastern Time. PQA staff will be on hand and we will be discussing quality measure risk adjustment. With that, click the registration link in chat. Be prepared to join us next month. We'd be glad to see you. And thanks so much for joining us today, and have a great rest of your day.